Dr. Prabani Wood is as I said to you, she's a general practitioner. She's got a master's in public health uh, from Auckland University, I think. Oh, she'll tell us anyhow. But more importantly than that, she has just written, I think, an update, because I'm pretty sure she wrote a report a couple of years ago, a report for the New Zealand Initiative, just out yesterday, in actual fact, which suggests that the doctor drain is not slowing down, that there is a crisis in terms of our public health, but particularly with our GPs and general practice. And she's entered in a funny sort of way a real debate, and contentious and provincial debate, as to the 380 or the proposed $380 million Hamilton-based School of Medicine, which presumably will either be given or not given the tick of approval at the budget in a month's time. And Dr. Prabani Wood joins us now. Lovely to have you on, Prabani. Welcome to the show. And I'm trying to put, there you are. Welcome to the show.
Thank you. Thank you for having me.
Now, first of all, tell me about yourself. I've got that right, haven't I? You've been a GP for a long time, and you've also got into the policy side of things as well.
Yes, I did my medical school training at Oxford University in the UK, and I moved to New Zealand in 2005 with my husband. I've done all my GP training in the New Zealand system, and yes, you're right. I did a master's in public health at Auckland University.
Well, I would think we're doing pretty well out of you. You did your medical degree at Oxford. It's not exactly a slack medical institution, is it really?
I think yes. I don't think you'd call it slack, that's for sure.
No, well, see, you're a positive story about immigration, Prabani. That's fantastic. What does your husband do, by the way? Is he in medicine as well?
Yes, he is. He is an ENT surgeon, and we're based in the Waikato.
Well, now here's a question. Why don't specialists go to Gisborne Hospital? Oh, just quietly, because they're having a crisis of their own at the moment. Am I right in saying that there are certain particular hospitals and regions in New Zealand that struggle to employ health professionals, A, because they're too isolated, they think, from everywhere else, and B, because they don't like the culture?
I don't know really what the answer is to that. It's certainly, there is a sort of two-tier system in New Zealand between rural regions and urban. I've got personal experience as well. My father, who's recently retired, he was the only permanent obstetrician in Whakatane Hospital for over 20 odd years. He finally retired at the age of 75, and it was hard. But he loved being part of his community and serving them.
So actually, Whakatane is the other name that's just come up, because this week I think they've got a crisis in their maternity services. Ironically, I think possibly because your father's retired at 75 years of age. Is that right?
Trying to retire for many years, and flagged that up to the management for many years. Because obviously, when you get past a certain age, you would think that you would be thinking about retiring. I think it reflects difficulties in long-term management and long-term planning within our health system. I think that's what it comes down to. So someone who, eventually only retired at the age of 75 when he flagged up. It's not like one day he was 60 and the next day he was 75. He did flag up that he would be planning to retire. And he couldn't. He stayed on for many years because they couldn't recruit to his role.
No, fair enough, and well pointed out. Listen, talking about GPs though, and a report I think, I'm pretty sure I read it a couple of years ago, you did a report on, I'm pretty sure, for the New Zealand Initiative on the crisis in GP recruitment and retention then.
No, that was Professor Des Gorman and Murray Horn. So
was that them? Okay.
Yes.
Actually, interestingly, they also did a report on the COVID response as well, which everybody tried to ignore.
Yes.
But you've now come out with this report that you've now authored on this particular issue. What was your major thesis? What were your major findings?
Well, firstly, it was a follow-up from the earlier report, and it's from a personal perspective, or a real-life lived experience of a GP and someone who's also been a practice owner. And why I wrote this report were three main reasons, really. I absolutely passionately believe in the importance of primary healthcare. We know that with good primary healthcare, everyone can live longer, healthier lives and save the system money. And GPs are at the heart of primary healthcare. And second, the reason I wrote this report was because I think it's really, really important that people understand just what it is that we as specialist GPs do. We have to have, it's a specialty like any other specialty in medicine, and you have to have a huge, broad range of knowledge to look after the whole person. It really is holistic care. And you don't get the full value add of GPs if you don't have continuity of care. And by that, I mean allowing your GP to get to know you, build up a relationship so that you can diagnose and treat things early, reverse early disease, refer appropriately, and prevent diseases from happening in the first place. Now, this is especially true for things like mental health issues, diabetes, cancer. If you want to improve those things, you need to get in there early. The old adage, prevention is the best cure, holds true, right? And I know from personal experience that patients want to be able to say, well, that's my doctor, and they want to come and see you when they need to.
They do.
And I think that's essential, right, for everyone.
Well, it doesn't. It's not rocket science. That's exactly what we want, and that's the we've had that practice ever since, but we don't have it anymore. What happened?
Well, we still have it in pockets, but I know from personal experience that that ability to provide continuity of care for your patients is getting eroded each year. And primarily it's due to that lack of funding in primary care. New Zealand, over the last 20 years, on average, has spent only 5.4% of the health dollar on primary care. And if you compare that to some other OECD countries who have better systems, they're spending around 14%.
Oh.
And I think then you add in that extra issue of that fee for service. A lot of places where I grew up in the UK, you don't pay at the point of contact to see your GP. That adds in an extra nuance as well. Even though actually, the health dollar, there's much less going into it, but the fact that people are handing over money adds an extra layer to all of this. We simply.
So you're saying that I can tell you now, that's a real barrier as to going to a GP, is having to pay that what they call co-payment on top. That would be. Are you suggesting that should be free for all New Zealanders?
Well, I think studies have shown having a nominal payment allows people, to attach some value, so you don't just, forget to turn up to your appointment. But I think it needs to be affordable for people, absolutely. But GPs aren't putting up their prices because they're being greedy. They're putting up their prices simply because 30 to 40% of the work they do is unpaid, and they simply can't run their practices. They simply can't afford to keep the electricity going and pay their staff. So that they've got no choice but to increase their payment, because otherwise they have to close their doors.
The average age of specialist GPs, I think you noticed in your report, is 54 years of age, and 45% of GPs intend to retire within the next 10 years. Mm-hmm. Now, I know why you've written that, because you're suggesting if you think you've got a recruitment retention crisis now, it's just going to get very, very much worse. Can I ask the question of you, will the medical school that's proposed for Waikato, which is specifically aimed at training GPs, make a difference?
I think training more doctors to become GPs is always going to be helpful. But if you want to think of it this way, we've got a bucket with a massive hole in it. Putting, more GPs in at the top is definitely going to help, but you have to plug the hole. You have to retain your workforce. There needs to be, experienced GPs need to do the training for the trainee GPs coming through and the medical students. So we have to fundamentally change the working conditions for our current GPs so people stay and it becomes an attractive career choice for people for going through medical school. I know that when I was training, roughly about 10% of my time was spent in general practice training. And I believe that similar to what students in New Zealand experience as well. 90% of the work is done in general practice, yet medical students get such little exposure to it when they're training.
Well, whose fault's that? That's the med schools, isn't it?